The next company is Corline Biomedical. Corline develops, manufactures, and also markets heparin-based solutions to improve kidney transplantation, cell therapies, and also applications in the evolving field of regenerative medicine. And with us here today, we have the CEO, Henrik Nittmar. Please give him a warm hand.
Thank you very much, and thank you very much for listening in to this presentation of Corline. So Corline is all about giving people an opportunity to improve their lives and giving them the right to enjoy daily life. And we do that by a heparin-based platform of products. The two core products is Reperfusion, that is under development for improving kidney transplantation, and then CHS, Corline Heparin Surface, which is a best-in-class medical device coating technology. Let's start with Reperfusion. So Reperfusion is focusing on kidney insufficiency, of course, and end-stage renal disease represents a major cost burden to any Western society, and this is an example from the US. And we can then see that an ESRD patient costs around 33 times the cost of a non-ESRD patient of the same age. And so it represents, in the US, I think 8% of their combined healthcare spending, a staggering $35 billion US. And one way of addressing that problem is, of course, to convert the patients on dialysis to a transplantation of kidneys. So you see that the cost comes down dramatically. You reduce cost by 2/3 or even up to 80%. But there is a challenge of converting patients to transplantation, and that is spelled organ shortage. I'm sure you've heard about this in the press and media. Just recently, I think day before yesterday, that was a piece of news in Sweden, and it's all over. So what we actually see is that we're adding more patients to the waiting list for a kidney transplant than we're adding organs that are available to transplantation. So that means that around 5,000 to 10,000 people die each year in the largest European countries and US combined. This leads us into a situation where we tend to accept what we call marginal donors more and more. Marginal donors are donors of age, 60 years or more, and or combined with an underlying disease history like diabetes or high blood pressure. And the problem with these marginal donors is that marginal donors leads into clinical problems. And marginal donors are also used even more so in the US, or will be, because in 2019, the then President Trump signed a presidential order saying that we should actually double the number of transplantations made in the US in order to handle the healthcare budget issues that he saw. So that means effectively adding 20,000 more transplantations each year. And that kind of exacerbates the problem of using marginal donors and their association with what we call ischemia reperfusion injury. So they're more susceptible to these injuries, and ischemia reperfusion injury is a clinical state, a problem that occurs when the organ is awaiting transplantation, while they have been explanted from the donor and sits in an oxygen-free state awaiting transplantation. And during that time, the inner layer of the vasculature, the endothelium, is activated and shedded. And then underlying very thrombotic and inflammatory responsive underlying structures are exposed. And that leads into a problem when the patient, the recipient's blood, meet these injured structures of actually eliciting a response in the underlying functional kidney tissue, leading to what we call delayed graft function. So the function of the kidney it is depleted during the first days after transplantation. And in the worst case scenario, the patient actually needs to go back to dialysis directly after transplantation. And that is called, in a kind of a clinical term, delayed graft function. Affects 40% of all kidney transplantations. In the acute state, it leads to prolonged hospital stay. But even more importantly, it is also associated with a more poor outcome. If you look at the transplantation patient community, after 3 years, The graft survival rate, if you have experienced DGF, is around 85%. So 15% of this group has a non-functioning graft and needs to go back to dialysis again. Whereas if you look at the patient group that has avoided DGF, they have above 90% patency rate of their graft. So it's a huge difference. And that, again, adds to these patients going back to dialysis and going back to the waiting list for a new transplantation. A massive problem. Our solution to that is to add our renaparin molecule, which is a macromolecular conjugate of heparin, not going into the details of that, but it kind of emulates how the endothelium, kind of a healthy endothelium, works and looks like. So we address the injuries by kind of covering them with our heparin layering technology, kind of fooling or tricking the immune system to see this as a coherent, healthy vasculature or endothelium structure. So that is what we do. We just simply add it to a standard preservation solution, which is perfused through the kidney in any case. So we kind of combine it with an existing technology. And then we get it to adhere to these injury sites and protects the vasculature. And our preclinical studies show a very good effect of that treatment. And then also we have conducted phase 1 safety studies showing a good safety profile of the product. And we're now about to start our phase 2 efficacy study this year. So that, the phase 2 study design very shortly. It's a multi-center, 12 sites in Europe, UK, Germany, Austria, study of 80 patients, 40 of which are placebo, the other one in the effective arm. And we will follow what is called eGFR, that's glomerular filtration rate, the functionality of the kidney, out to 3 months, which is the kind of efficacy measurement accepted by the FDA for a pivotal study. This is not a pivotal study, but anyhow, it emulates a pivotal study. We will focus, in order to kind of decrease the size of the study and also the study time, we will focus on the marginal donor group, not all comers, as we did in the safety study and as we will in the phase 3 design. But for this efficacy study, we will kind of focus it on the marginal donors. And we'll also, of course, look at safety at that time. And we will, in addition, we will do an interim study analysis after half of the study population, so 20 plus 20, to do any readouts at that time. The overall timeline for this product and also the phase 3 study starting point is estimated to end of 2023. And then we're looking at potentially a licensing agreement at that time point, or else we go forward with our own design and financing of that study, depending on the results of the study, the phase 2 we're currently conducting, but also, of course, the financing community at the time. In any case, this kind of represents a healthy marketing opportunity or market opportunity for a product being approved for this DGF IRI indication. Going back to the other arm of our business, that's the traditional device coating, CHS, Corline Heparin Surface. It is the same technology, and the basic technology when it kind of sits on an implant looks like this. It works in the same manner as when we do it for the kidneys. We kind of coat the surface of interest, the thrombotic surface. In this case, it's a metal surface and a coronary stent that is represented here. It could be glass, plastics, or any type of blood contacting device material. And we can put it on any substrate. In the medical device applications, we use a priming technology that is kind of makes it possible to address any type of application out there. And then we will get the same type of response as in the kidney transplantation with a anti-thrombotic, anti-inflammatory functionality on the surface. So we kind of, the biocompatibility of the surface is increased. So this is how the technology looks in some kind of focus. The CHC part, the macromolecular conjugate, is the same for the renaparin product as it is for the CHS. The only thing differing here is kind of the specifications, of course, but also how we apply it. In this case, we apply it with the primary technology. We manufacture the reagents for this purpose, and we also do coating services in our facility in Uppsala, which is a small but very effective facility. The kind of peak volumes we have handled in that facility is 40,000 coronary stents per year. So the product has been used clinically for more than 100,000 patients in the German market historically. And we do that for our customers, I said, the service coating for our customers. And just a couple of examples of customers we're working with in the CHS space. This is a company called Cardium. It's a Canada, Vancouver-based company, active in the space of heart arrhythmia. So atrial fibrillation is their kind of indication. And they're working with a very advanced new type of device, a catheter-based device that combines two functions, diagnosis of the arrhythmia and also treatment in the same type of catheter. That reduces the indwelling time from 4 hours to maybe 20 minutes, and also kind of increases the effectiveness of the treatment as it is less dependent on the actual individual doing the treatment. They have kind of objectified the measurement of the arrhythmia and also the therapeutic effect of their treatment. So it's a very interesting new type of catheter. It's approved in Germany, actually, and in the European Union, in a non-coated version, just for kind of clinical trials and stuff like that. But as you can see, it's quite complex in its geometry, and it's likely to elicit a thrombotic response. And the worst case scenario in this type of treatment is that you actually get a blood clot around the device, and that blood clot is released. And when it's released, you have a very high likelihood of patient getting a stroke. So that is something you actually want to avoid to 100%. So that is why they need to have some kind of coating. And ours is one that is representing the best kind of functionality in the market. So that is why they've chosen us. They were kind of a medium-sized, highly growing company, or a very rapidly growing company. And they just kind of recently announced a new financing round of substantial matter, kind of supporting this program. So we're very excited working with them. We just started clinical trials in Europe and in Canada with a coated version of this, so that represents an advanced stage of development, albeit it is in a pre-commercial state at present time. Another very interesting example is Imperative Care. It's a stroke care company based in California in the US. And they have currently 2 products on the market, a catheter, access catheter, and then also a clot removal part of that catheter. Highly successful US-based company, medium-sized again. And they also kind of recruited financing of substantial amounts just recently, supporting this program. We are developing, or they are developing, a kind of non-communicated implant of sorts. So it's a permanent implant in the brain where they need an antithrombotic functionality, and our coating will represent that technology. So we're very excited, and we say that we have a potential revenue stream of in excess of 35 million SEK. I think that's on the low side in this case. In any case, it's a very interesting company to work with, and they're really putting in a lot of efforts, both from an organization standpoint and also financially. We're working with up to 10 companies in parallel at a given time to add to our pipeline in the CHS space. These are examples of companies we're working with currently. Our goal is to have maybe 4 or 5 projects active in a commercial state in a couple of years. And our revenues are growing from a small number, I'll admit that, but it's growing quarter by quarter. And more importantly is that we have a commitment from our device customers that they cover all the costs of their development programs. So CHS is cash flow neutral in our company, whereas the investments are going into the Reperfusion project. So we're kind of growing our business and the traditional side of our business, and then we maintain the potential of the kind of big potential in the Reperfusion project, the pharmaceutical part of our project. And the nice thing here, the good thing here is that it's based on the same kind of technology platform in both cases. Just giving you a taste for what we're looking at the CHS. This is Carmida. This is a Stockholm-based company, has been around for many, many years, and they're highly successful. They're currently 100% owned by Biomedical, the medical device arm of Tech's company. And they have a very profitable business based on maybe they have 2 customers. They have the internal customer, Gore, with 3 different applications. And then they have an external customer. And based on those very few, I would say, relationships, they kind of stage a very successful business. And we are aiming for the same type of numbers in our business. This is our management team and board, a highly experienced board representing both the pharmaceutical industry as well as the medical device part of our business. And the same goes for the management team. We've just added new hires to support our device organization primarily and the regulatory and quality field. So we're kind of approaching that marketing or market launch phase very quickly, and we're very happy about that. So that was it. Thank you very much for me.
Well, thank you very much, Henrik. What would you say is the key success, the core success factor in your company? What is that sort of your uniqueness?
So it differs between the 2 strains of businesses, I think. In the medical device part, which is as a very kind of day-to-day routine business currently, we don't kind of have any technological advanced development currently. It's more a matter of delivering on our customers' programs. And then it comes down to quality issues, it comes down to kind of supply issues and stuff like that. So it's a very day-to-day business. Short-term focused, and then kind of meeting their expectations of our organizational build-up. That's the challenge there. Whereas in the Reperfusion area, of course, it's all about having the right kind of data results or results from the phase 2 study. So kind of getting that on board and receiving the results. So it really comes down to that and for the Reperfusion project.
And investors looking at investing in your company, what can they look forward to?
So we have, I mean, since we have 2 kind of different businesses, we've also 2 different type of investor interests, I think. And many new-coming investors have looked at the medical device business, and we're really kind of building up the revenues month by month here, and but the kind of the hockey stick effect will come when we have a market-launched product together with our customers. So that will be the kind of point to look at time-wise in the company, I think.
Well, thank you very much, Henrik.
You're welcome. Thank you.
Thank you.